So my name is Abby. I'm the health promotion coordinator at the Halifax Sexual Health Center. So normally I'm out in the community doing workshops, both with community members and schools, as well as health professionals. But now I'm in an exam room recording things online.
It certainly is a different May than what we usually have. Hi, my name is
Yeah.
Rene Ross. I'm the executive director and the sexual health educator at the Sexual Health Center for Cumberland County. What are you seeing right now at the Halifax Sexual Health Center?
So we're still seeing patients. Our schedule is definitely reduced, but there's very few appointments that we're actually not doing. Most of it has just been translated into telephone visits instead, but we still can see you in person if necessary. So we have like a triage system that our administration team and our nursing staff are working with before they book you. So there might be a couple more questions than there normally is before we book you an appointment. Timelines are definitely way off. People are used to waiting 4 to 6 weeks for an appointment with us. But because everything is so chopped down and we've been restricting how far ahead we book, right now we're only booking like a week in advance. So that's amazing for us. We haven't done that in years. So that's kind of good, is that you are going to be seen soon. The biggest change that like our sort of bread and butter of STI testing. So that's pretty different. So right now, what we're doing for that, well, maybe I'll talk about what it used to look like. So what a
Mhm.
normal STI testing process is. So in the past, we recommend testing once after every new partner and once a year just in case, even if you've been with someone for a really long time. And then if
Yeah,
that's
some
not possible,
STIs can stay,
yeah,
or yeah, like that you don't even know that you might not even know that you have them for
you
years,
have them.
right?
Yeah, and I mean we trust our partners, but just in case, it's
Yeah,
good for your health to
yeah,
test that just in case.
yeah.
Um, and then we also recommend testing every 3 to 6 months if you participate in any sort of like high risk activities. So things like group sex, multiple partners, sex work, if you are having sex while using drugs, anything like that. There's also some medications that mean that you should get tested sooner. So if you're being treated for HIV or if you are taking PrEP, there might be some more testing that you would be doing much more often than other folks.
And we don't offer STI testing at our rural centers. I wish we did. There's such a big need for it because
You end up seeing your clients. And if you
yes,
are worried about access to STI testing right now, it is still happening. So I'll sort of
yes,
explain like what's changed. It's a little bit different
yeah,
if you've been tested before. So first of all swabs are being used for COVID testing. So that means that we can't do any vaginal swabs right now. We have like a couple like fancy kind just in case you're like a particular case, but everyone is doing urine testing. So that means even if you have a vagina, you need to make sure that you don't pee for 2 hours before your appointment. And you'll just give a urine sample instead. We can still do anal swabs if it's necessary because we've kept a couple for those. We can't do any throat swabs because that's a risk to our doctors to like get up in your mouth during a pandemic. So if you're worried that you've also contracted something orally as well, they'll just treat you as if it's in all sites. So like they'll have a conversation with you about that. So that's different. And then also, we cannot do any HSV, so genital herpes confirmatory testing. So in Nova Scotia, normally you take like a fancy viral swab and you apply it over a lesion, and that tells you whether you have HSV. So right now we can't do any of those at all because those are all being used for COVID tests, and they were all taken back to the lab like really, really early. I think in late March or early April.
can't you only test for HSV, also known as genital herpes, when there's an active outbreak?
That's right. Yeah, but
Yeah,
they can still diagnose you visually. So we would just set you up with an in-person
yeah.
exam, and they can just look at you. And then if they're not sure,
And
like
there's
there's
other
lots of
symptoms as
interventions.
well that might, yeah, like
Yeah, yeah, lots
that
of
goes
things that they
along with
can
it.
use to sort of help you um, come to terms with that or diagnose you. Or if they're unsure, you know, we'll go back to normal eventually,
Yeah,
and we'll have access to those again.
yeah.
So it will happen in some way. You'll be taken care of. So those are sort of the big differences, especially those swabs. If you're not used to doing a urine sample and you come in and you're not ready to pee and you like peed 10 minutes before your appointment and you have to come back in 2 hours, that sucks. So we just want to kind of keep that in mind. And we're only doing essential STI testing. So that means no more like once a year, just in cases.
Yeah.
sort of testing. We're not doing that like sort of peace of mind, but we are still doing testing if you feel you need it. So like if you've had
Okay.
an unprotected sexual encounter recently, if you're still participating in any of those like sort of riskier sexual behaviors that I mentioned before, so things like group sex, sex with drugs, sex work, if you're still on PrEP or your HIV medications, you can still get tested. That's considered essential as part of your care. So they are still happening. We just need like a little bit more of a justification to do it. So what we've been doing is we've been booking a phone call with the doctor first, and then you would come in and see our nurse and drop off a sample at that time with her, or we'll book you a second appointment with a doctor if you feel that you need like a physical exam.
So somebody from Cumberland County, though, if for some reason that I'm not able to get through to a family doctor or to a
Mhm.
nurse practitioner, I can call myself or you,
Oh yeah,
somebody at the Halifax Sexual Health Center. So
yeah. So we're also not drawing any of our own blood right now, but we can still write you a requisition, and you can still go to your local blood lab. Most are still open. They're just working a little bit differently. So their appointments instead of drop-ins, and they'll be dressed to the nines in their PPE gear. So that's still happening as well. We'll just give you a paper instead of drawing it in our own location at this time. So what that means, unfortunately, is that anonymous testing is not happening right now because you can't go to a blood lab under like an anonymous code. So unfortunately, that is postponed for the time being. The only other anonymous site in Nova Scotia is in Cape Breton, and I'm not sure what they're doing there. But I know on our end, unfortunately, we can't do it anonymously at this time.
yeah, well, and
Oh,
hopefully, like, and folks comment on this video, right? If there's
mhm,
anything that you have to add around access to STI testing and what's happening
mhm.
in the province and where folks can go to for support, and if there's anything that we missed
Yeah,
or didn't cover, let us know and reach out. We're all still working
yeah.
and providing education and outreach and services. And thank you so much, Abby. It was so
Oh,
nice
thank you.
to
Thanks.
catch up with you.